Mounjaro is a GLP-1 agonist that is used for both weight loss and diabetes, and it's the newest of the weight loss injections. Mounjaro can be used at different doses. The starting dose for Mounjaro is 2.5 milligrams. This can be moved up to 5 milligrams, and then up to 7.5 milligrams, then 10 milligrams, and then 12.5 milligrams, and titrated all the way up to 15 milligrams. Treatment is a once weekly injection, and this can be administered by yourself or by a clinician. The treatment is administered through the skin into the subcutaneous fat. I'm now going to show the device and demonstrate how the treatment is administered. To prepare your station, have the device ready with the needles that attach to the device, and here we have the 4mm pen needles. We also have our sharp spin and a skin swab to clean the skin. I'm now going to unbox the 2.5 milligram and 5 milligrams. I have removed the device from both of the boxes, so I have a 2.5 milligram and a 5 milligram pen. As you can see, the pen look identical except for the number and the value on there. The value on here says 2.5 milligrams and the value on here says 5 milligrams. All of the devices come with a leaflet to demonstrate how to use the device. We're now going to prepare to inject. First of all, start by cleansing your hands. Step 2 is to remove the cap from the device. Keep the cap on the side and inspect the pen to make sure you're using the right dose and that it's within date. Step 3, wipe the seal. Step 4 is now to apply the needle to the pen. The needle comes in a covered cap like this. You pull off the foil and you will be able to see the sharp bit that will be attached to the pen. Place it onto the device and you twist it on until you feel the seal close. Then you can remove the cap and there will be an extra layer of protection which you can remove before treatment. As you can see, this is a very small needle, 4 millimeters in length. At this stage, we have attached the needle to the pen and now we must prime the needle before injection. To prime the needle, we twist until we hear 2 clicks and then we press and we may see some fluid coming out to the top of the needle. That shows us that the needle is now primed. Now that the pen has been primed, we can move on to injecting. To do this, we twist the cap until we get to a click. That final click does not allow us to move the pen any further, and we are now where it says number 1 on this. That means we are at 1 dose for the pen. This is now ready to inject. In order to now inject this, we now position this either on the back of the arms, on the thighs, or on the abdominal area. Then locate where you're going to inject, clean the skin with a skin swab, and then do a sharp entry, quick sharp entry, and inject. Once you've injected and removed the device, you may still see a drop of the drug on the needle tip. That is normal and will not affect the treatment dose. You will see that the dial has returned back to 0, and we can now remove the needle from the device. To do this, we use the cap that came with the needle, we place it on top of the needle, and then we just twist the cap off. This can now go into the sharp spin. Once the needle has been removed, you will notice that the rubber bung within the vial has gone up, and this will continue to go up every dose, up to 4 doses within each pen. That will allow you a once weekly injection for 4 weeks. We can now recap the pen for storage. Once it is recapped, it can be stored at room temperature. You must note that any pens that have not been used must be kept in a refrigerator between 2 to 8 degrees. But once it has been used, it can be stored at room temperature for the next 3 injections. That completes the live demonstration on how to use the Mounjaro KwikPen. Remember to follow the manufacturer guidelines as set out within the leaflet within the box when using this treatment. Once administered, you may notice a slight blood spot at the site of injection, some redness and some swelling, and this should subside on its own within a few hours. If this progresses or the swelling gets worse or you're concerned, contact your clinician for further advice. In order to up-titrate this medication, you will start at 2.5 milligrams, moving up to the 5 milligram dose. If you do not have a 7.5 milligram pen, you can do both a 5 milligram and a 2.5 milligram injection. Likewise, for the 10 milligram dose, you can do 2 5 milligram injections. Similarly, for the 12.5, you can do 2 5 milligrams and a 2.5 milligram injection. And then for the 15 milligrams, you can do 3 injections of the 5 milligram pen. However, it's important to consult with your clinician before doing this. Following the administration of the medication, most patients may complain of a degree of nausea and reduced appetite. This is normal. However, severe vomiting and severe abdominal pain must be reported as this may need further investigation. Before using the actual pen, we do encourage everyone to use the demo pen in order to familiarize themselves with how the treatment works and how to use the device. So to summarize, we have demonstrated how to use the Mounjaro KwikPen, how to prepare, administer and up-titrate the medication. I hope you found this useful.